Hi, I'm Sharon Racusin and the host of Voices for Justice. The goal of this show is to allow social and economic justice activists give you an opportunity to get organized and connected to the important struggles happening in our community and in our state. You're not alone. Join us. Healthcare is a human right. Hi there. With me in the studio is Sarah Rosenstein, third-year medical student at Geisel School of Medicine in Hanover. And Sarah has been an advocate in many areas. She's volunteered for WISE. She's volunteered at the federally qualified health centers in Corinth. She's been down to the border in Tijuana, helping provide medicine and physician advocacy for people who have been forced into camps down there because they have nowhere else to go. And in this segment, we're going to talk about your volunteering with the membership with Medical Students for Choice. And it's especially pertinent because yesterday, Planned Parenthood decided to withdraw from Title X funding because they're being forced into an untenable situation, something that has been coming for a very long time. This is not new, just like nothing is really new. It's been preempted many, many times by policy and other administrations trying to cajole and make nice to what's essentially religious zealotry. The evangelicals in this country have been pushing for many, many, many years, 40 years, to not provide abortion money to clinics that provide women's reproductive care because they also provide abortions. But the one thing that a law states that the funding cannot be used for abortions, and those clinics do not use that money for abortions. It's separate. Now there's a gag rule saying that the clinics cannot even tell their patients about having an abortion or anything about that. This is zealotry. It is based on faith, not on science. And the focus has been on Planned Parenthood. This is truly ridiculous and devious. So Planned Parenthood has decided to just walk away from that funding. And they should, because it can't be condoned.
No, it's untenable for them to provide the services that they do while receiving that funding. And the government this administration has made it that way.
That's right.
They've been receiving that funding and been able to provide comprehensive health care for all people. And that's been no problem. But with the new laws, they're not able to do so anymore. So they've pulled out, and I would just like to say, please donate to Planned Parenthood. Planned Parenthood provides amazing comprehensive care for people throughout the Upper Valley that is needed and not able to be accessed elsewhere. So if you can, donate to Planned Parenthood. And I'd just like to comment on what Sharon said. You know, the evangelicals have been behind the movement to restrict abortion since Roe v. Wade, no doubt. But when you look higher up the chain, the people who are in power aren't necessarily evangelicals. That's just their base. What they're looking to do is just restrict women's access to living equal lives with men by forcing them to have children. It's the patriarchy wanting to keep women down and stop them from being equal members of society. Whatever a woman chooses to have an abortion, whatever reason a woman chooses to have an abortion, she has a legal right to access those services.
At this moment.
At this moment, she does. And that's a medical service. That's not a political service. And the fact that the two are so entwined is really scary for me as someone who wants to work as a family planning provider. I don't want the government telling me how to practice my medical care. I'm getting a great training on how to do that. I don't think most politicians would know how to provide any type of family planning care, yet they're having a say in what medical professionals can advise to their patients, which is limiting them from receiving adequate health care. And even if you look at Planned Parenthood now, without that funding, people aren't going to be able to access as many services from them just for basic sexual health, pap smears, birth control, a whole slew of things that have nothing to do with an abortion. But now the government is coming in and messing with access to those vital services as well that people can get at Planned Parenthood for a reasonable rate where they can't access them otherwise. So it's not just abortion now that we're talking about, it's all sexual health care that is essentially under attack.
Right, and so, you know, you may have heard this before, but this administration, Republicans in general, conservative, ultra-conservative, want small government, but they stick their nose in where they don't belong. They don't belong, just like insurance companies don't belong in healthcare. No. Neither does the government. No. And so this is, when people say, how can evangelicals support this administration and this president? And it's because he's giving them exactly, he's just looking, you know, he's looking the other way and letting them create policy, again, based on their faith. It's their faith. It isn't all faiths that believe this, but they are making a ruling based on something that they believe. It's not based on science. And they are pushing Planned Parenthood. They want them to dissolve. They won't because there's enough people who support them. I'm a monthly contributor because I don't want them to go away. I used them 50 years ago. And I got great health care there as a teenager. And there was privacy where it should be. It's my health care.
Yeah, you don't want Donald Trump sitting in your pap smear appointment with you, right?
Like, I could say something about that, but I'm not.
I know. That's essentially what's happening. It's like we have the government sitting in on healthcare appointments. So I don't want to be a provider who has to be censored based on what the government tells me. That's not democratic.
That's right.
It's not democratic to censor healthcare providers in what they are and aren't able to tell patients.
So. And just like, you know, there's pressure on emergency rooms to provide primary care, abortions are not going to stop. They never have. They've always occurred. But we're going back. When I graduated high school was when Roe v. Wade was passed. And I know women who resorted to those so-called back alley abortions, and thankfully none of my friends and acquaintances died, but there will be. There's desperate, you know.
There already are, actually. We've restricted in some areas of the country
that's right.
the access to clinics that provide abortions so much that a couple of years ago we had a woman die after self-inducing an abortion in the United States of America. So it's already happening here.
And that those states in the South, right? Alabama, I'm going to say
Yeah.
Kentucky. I'm guessing.
So yeah, there's multiple states now that have laws out, either restricting abortion to when it would be before a woman would know she was pregnant, or restricting it altogether. That's a change in laws. You know, we saw laws for the welfare of the mother. Abortion is 10 times safer than carrying a pregnancy to term. And you were right, the abortion rate won't go down. So we actually see lower abortion rates in countries that have the best access to family planning services, to birth control. So restricting those services will actually make the abortion rate go up. It was higher before we passed Roe. And so that's not going to change. Women will always access abortions, but if they're safe is the question. A safe abortion has such low complications, but self-induced abortion, super high complications. And we don't want to go back to that. We don't want to go back to having hospital wards full of women who have self-induced, who are dying. That's a terrifying reality that we're facing right now. Attending the Med Students for Choice National Conference 2 years in a row, I noticed most recently that it's becoming desperate. The ACLU is predicting that Roe will be overturned and it will be states' rights. And so the focus in advocacy around abortions has changed from improving access to how are we going to provide access if Roe is overturned. And there's several ways we talked about doing that, but it's a totally different conversation now. It's an all-out war on women in this country at the moment.
Yes. Ending on that positive note, it's the truth. Women, men, get out there, support Planned Parenthood, speak to your representatives in your states. In Vermont, the legislature secured the right for every woman to receive an abortion, even if Roe is overturned.
Yeah.
And so,
yeah, we need to work on this on a state level at the moment. So call your representatives, call your senators, donate to Planned Parenthood, and let's save as many lives that way as we can, because that's really where we're ending up right now.
Thanks, Sarah, again.
Thanks, Sharon.
For your knowledge, and much appreciated. And good luck in school.
Thanks.